So I'm happy to present our manuscript and our work on streamlining the diagnostic pathway for Lynch syndrome in colorectal cancer patients. We know that Lynch syndrome is the most common hereditary cause of colorectal cancer, caused by germline mutation in DNA mismatch repair genes. However, we know that worldwide, Lynch syndrome is largely underdiagnosed. Few years ago, all the international guidelines recommended universal screening for mismatch repair deficiency in all colorectal cancer patients. However, not in all countries and all over the world, this is not still is not the standard of care. However, with the immunotherapy benefit, more and more patients are tested for DMMR, both in metastatic and neoadjuvant and adjuvant setting. However, we want to get all these patients and give them the opportunity to be diagnosed for Lynch syndrome. We know that 1 or 2 out of 5 patients with DMMR they will have Lynch syndrome diagnosis. In our work, we try to streamline the pathway of diagnostic for Lynch syndrome. So patients with MLH1 loss, we provide reflex testing for BRAF mutation and hypermethylation of MLH1 in case of BRAF wild type. We notice that reflex testing reduces the number of genetic counseling sessions and increases the diagnostic yield of germline testing. This was important for us because it gave us the opportunity to run an observational national study, which is ongoing now, which is called ItaLynch study. In which we are trying to investigate the feasibility of a novel diagnostic algorithm for these patients. So all the patients that are selected for genetic testing after reflex testing, they can receive a mainstream genetic testing from oncologists instead of getting a genetic counseling pre-test. In this way, we want to prove the feasibility of a novel diagnostic. Still, the study is ongoing, so I don't know if we will prove the feasibility. But still, in this way, I think we gave the opportunity to all the more than 30 Italian centers participating in our observational ItaLynch study to improve the diagnostic pathway for our patients and underline the importance to reach Lynch syndrome diagnosis for the patients, but also for the relatives.